everyone, to another episode of Wellness at the Speed of Light. I've been waiting for this one for quite some time. I'm your host, Dr. Stefano Sinicropi, and we are absolutely ecstatic today to have Dr. Antonio Webb, an orthopedic spine surgeon. Obviously, I'm going to be very excited about that because, that's what I do. That's what's near and dear to my heart. And most of my partners are neurosurgeons. So it's good to have, another one of us, out here doing what he does. But what an inspirational physician this guy really is. I've been following him for quite some time on social media, have watched so much of the stuff he's doing on YouTube. He gives back to the community. He's a stand-up family guy, just amazingly talented orthopedic spine surgeon. But really what attracted to me, other than his philanthropy, his nonprofit organization and things like that, was his ability to connect with regular everyday people and explain complicated topics in really easy to follow ways. And that is so important in this environment when we are bombarded with so much information and misinformation, we'll say. And it's so hard for people to cut through the noise and figure out really what is real and what's not real. And having a trusted source like Dr. Webb is really an incredible benefit for patients. And I encourage all of you to follow him. And we'll talk a little bit more about that at the end of the show. And we'll talk about where you can find them and that kind of stuff. So on that note, thank you so much, Dr. Webb, for coming on the program today, taking up some of your Sunday and speaking with us.
Yeah, no worries. Thanks for having me. It's a pleasure to be here to speak with you.
Thanks a lot. So your journey, not all my guests do we go into all their journey. A lot of times I'm really trying to get right deep into the weeds on some procedure that they're, known for, or some theory that they're espousing or something like that. But yourself, you have such a different upbringing and such a different path to becoming, an orthopedic spine surgeon. I encourage, again, everyone to watch your YouTube video on your transition from, your 15-year transition to becoming a spine surgeon. But can you tell us a little bit about your upbringing in Shreveport, a little bit about that and how it paved your mentality, your resilience, how you see the world, and how you think that translates to the type of physician you are today?
I grew up in Shreveport, Louisiana, and Shreveport at that time was a really dangerous time, just growing up there, and a lot of drugs, a lot of gangs, a lot of violence. I saw it not only kind of in my own personal family, but also kind of in my community. I personally had several family members that were in prison. I think at one time there were 3 out of 5 people in my family that were in prison at the same time. Ever since I've been young, my mom has been on and off drugs her whole life, and I think I was in medical school when she was actually shot, and she's a T10 paraplegic due to her drug addiction. My little sister went to prison when I was younger. My little brother was sentenced to a 5-year prison sentence for armed robbery. My dad, when he was young, he spent time in jail. He joined a gang, and got into a lot of trouble, just doing a lot of bad things kind of growing up in his neighborhood. So that's the type of environment that I grew up in. And it wasn't until I came across a medical magnet program that got me interested into the field of medicine, or at least just gave me the opportunity to just see something besides what I was seeing in Shreveport. And ever since that program, I always wanted to become a doctor. So I have a friend who's a cardiothoracic anesthesiologist now. We kind of stuck together and kind of stuck to the books and stayed off the streets. And kind of ever since that program, I always wanted to become a doctor. So
I'm just going to ask you a simple question. It's interesting because when I was, doing the research on your background, I mean, my background is obviously somewhat different, and I wasn't around all that prison stuff. I was adopted by foreigners, basically. It's just a totally different lifestyle, but I did grow up in the Bronx. And so even though the family that I was in myself was just a very loving family that just wanted nothing more for me to be somebody, boy, man, I was surrounded by so much crime and violence. I mean, people know the Bronx. They hear the Bronx, they're like, oh my God, you grew up in the Bronx. But Shreveport probably even more dangerous, especially from where I grew up. I wasn't in a semi-safe section. We'll just put it like that. It was a blue-collar neighborhood. There was certainly crime. It wasn't horrible, but I worked in places that, crack vials everywhere, all this other stuff, and always exposed, to things. A lot of people that I knew personally ended up going to prison, but luckily none of my family members ended up, in prison and stuff like that. So let me ask you a question. What was inside? Was it just because of who you are? Was there somebody in your family that you kind of looked up to that helped you to stay out of trouble? Because, as you know, like with your family members, it just takes 10 seconds, 1 second to ruin your life when you're in that circumstance. You just make that one choice. What do you think it was that got you through?
Yeah, that's a great question. I get that question a lot. And honestly, I would give credit to my dad. My dad turned his life around and became a minister. And I just remember going out in the streets of Louisiana, and we would just minister to people and hand out pamphlets and give them food. I saw that altruistic mentality that he had, and just seeing him kind of struggle day in and day out, just trying to raise my three siblings and I. Just seeing that actually just sparked a really interest in me. I was like, I don't want my kids to go through this, and I can't see myself living like this forever, so I have to change it. And then when I came across that program, I'd never looked back since then. It's been a long journey to get to this point, but yeah, I would say my father, just seeing him struggle day in and day out, and just he's always been there for me in terms of supporting me and encouraging me along the way.
That's fantastic. Thanks for sharing that. Obviously, we all need somebody, there for us. And that's why this whole, role that you've taken on as a real mentor. And I try to mentor, pre-med students or, whoever it kind of asks for my help. It's so important because it just takes that one person. I don't know if you're familiar with, one of my favorite people is Inky Johnson. And his story, he had that paralysis of his arm and everything like that. And now he uses that arm as a badge of honor, right? And I've seen him speak many, many times. I follow him. I just think he's just an amazing guy. I'm actually hoping to have him on my podcast one day. It's a little outside of but it is. He had a major medical condition. He talks about how he had like all those staples, hundreds of staples down his, but think about it, right? If it wasn't for that one coach kind of pulling him out of that environment, right? He was living like almost everyone in his family is in prison. It's just an amazing story. And when you were talking, all that popped up in my mind was Inky Johnson and whether you guys actually maybe even know each other, because your story obviously would resonate with him. I think he'll be telling your story because it's so powerful to get out there. Can you tell me a little bit about that program? I'm actually not familiar with that program. Just for our listeners, is that something that's still around? Is that something that we can, help to support? Or I just don't know much about it.
I don't think the program is still around anymore, unfortunately. I actually went back a few times and spoke at the program when I was I think a medical student or resident. My goal is to try to reopen that in Shreveport, Louisiana. Through my nonprofit, the Webb Family Foundation, I created a similar program here in town, and we just had our inaugural Dr. Webb Health Career Day, where we had students come and hang out with, I think there were about 15 to 20 doctors that were present. And that was a great event to just get students exposed to various career fields in the medicine space. And that's the reason why I wanted to do that program, was because of this initial program that sparked my interest. But that program was called the Fair Part Medical Careers Magnet Program. It was an afternoon program where we went to our main high school in the morning, and then in the afternoon we would go to another school, and they was just expose us to various things in the medical field, suturing, had guest speakers come in, and ever since that program, I wanted to be a doctor. So,
oh, well, good. I'm glad that program existed because it'll help, and it's amazing, what you're doing. And I saw the pictures from the your first annual career day. It's amazing, man. Guys like I see things like that. I mean, I get goosebumps because I understand that how many of these children, through no fault of their own, are not exposed to mentors such as yourself and all those, wonderful doctors that came there to volunteer their time. What the most amazing thing is, it could take one sentence coming from you just to give a kid hope. That literally that one sentence, and a lot of times you might not even know it. You just say stuff, you're just yourself. 30 years later, you'll get a phone call from them and they'll say, you know what? You said this to me. You made me believe in myself, and now I'm this. And is so special, and I'm sure that that is one of the things that fuels you, right? And like Denzel Washington says, there's nothing more selfish we can do than help somebody else.
That's exactly right. You know, growing up in Louisiana, I never saw a doctor before, especially a Black doctor. Never had met one. Nobody in my family is a medical doctor. YouTube wasn't kind of around, kind of growing up, so I couldn't like go online and just see all the content that people are putting out. But you know, you can go on YouTube or Instagram, TikTok, and you know, see doctors that are very successful and just talk about what they do. And that's really what inspired me to kind of get on social media was I saw that there was a niche for it and just kind of ran with it. So, but my goal and what my hope is, no matter how successful I become or will become, my goal is for a student to come up to me one day and say, "Hey, Dr. Webb, I'm in medical school, or I'm a doctor because of you." And that's what I really strive for. And you know, I've had some students come up to me. Random times and say that they, you know, I've inspired them because of my content or videos, but you know, that's what I really live for.
Again, just kind of going back to the other thing, I talk about this all the time. I'm very personally, like a lot of times I'll talk to my wife or I'll just talk to my partners. It is so important how careful we are with the words that we use around these young people, because again, any negativity, and I am going to ask you this is real. I mean, this is real near and dear to my heart because I experienced a lot of this particular thing. But any negativity that we spread, it goes the other way around. If a young person, even if they're struggling at the time, or even if they've gotten in trouble with the law as like as juveniles or something like that, we need to be spreading really positive messages to them, because if we say, "Oh yeah, you'll never do that. Unfortunately, you're never going to be able to go to law school because this happened, or because your mom is a drug addict, or whatever it is," negative words sometimes can have even more powerful, consequences on the other side. It's so important for us to be positive and really promote positivity. So what I will say is, and I was going to, and this is the segue, to the next question. One of the things I like to really talk about is, unfortunately, the times that, where I grew up in the Bronx and kind of who was I was around and things like that, even though I had a lot of really positive influences, I cannot even begin to list the number of people that I still owe a letter to just say, "Hey, you were very negative. You got to be careful with that. It was very discouraging, but yet I overcame anyway because I had so much pushback." I would tell people, "Hey, I want to be a surgeon one day. Oh, no, you can never do that. That's not, yeah, people from here don't make it like that. Oh, or, your grades." And without even knowing who I am or what I'm doing. Did you feel like in this whole time, I know you were able to be resilient and kind of get through, a lot of that noise. And yeah, you had a lot of noise. I give you. I mean, it's a very inspirational story. But did you feel like there was a bunch of people that were just saying you couldn't do it, or were you just like, did you just cut that off? Like that's not even like you don't even listen to that stuff. You just go right through it, no problem.
Yeah, I think it's a combination of both. You know, I can't recall any specific person, but I do know times I've been in the military, and while I was active duty in the military, I was going to school full time too. And I just remember just people talking about me just being a schoolboy and just from studying all the time and not going out and partying and things like that, which I still did. I just didn't do it as much as other people. But yeah, I don't recall any specific person. But yeah, of course, over the years, that there's been plenty of times and people have made remarks and things about my interest in the medical field.
What about when were going through medical school, and residency? One of the things I've talked about with other guests that have kind of gone down our similar roads in these intensive, professions. What barriers did you have, like in medical school? Did you ever have like people tell you, "Hey, I don't know why you're here," or get any of that thing, maybe because of your appearance or something like that? And then we'll get into residency and how difficult it really is, and how I do like to talk about, residency now. Things are changing, but it's still a challenge.
Yeah, I went to medical school at Georgetown. It was definitely a culture shock coming from Louisiana, and it was a great experience. Though I had a great time there, and I had a lot of great mentors that, especially senior students that were a year or two above me to kind of push me along. But yeah, plenty of opportunities like that where people kind of doubt you along the way. But I can't think of anybody in my medical school class who probably worked as hard as me in medical school, kind of throughout the whole our 4 years there. So no matter what people say or what they do, I mean, I just keep pushing along, and that's what I've always done. I'm pretty sure you've done the same as well.
Yeah, I have, it's funny, we all have different, personalities. Obviously, I love because I could just tell by the way that you respond to the questions that you're the type of person that it's just kind of like you're very resilient, probably because you're the way you grew up, and you might hear comments or two, but you're the type of person that like 10 minutes later, it's almost like you're a cornerback in the NFL, right? If you get burned down the sideline and you give up a touchdown, if you're thinking about that, you're done. Your game's over. It's over. Yeah. They'll be picking on you the whole time. So I think that your level of, resilience, and things like that, and we all do it. And I see that with my young sons. I have two teenage boys, and they both deal with strife very, very differently, from each other. One's more quiet and reserved, and he internalizes and has to think about it, doesn't really want to talk about it and then the other one is like, he'll go on the immediate attack. Like you can't, like, if you even start with this kid, and good luck. We always say, like, good luck with somebody trying to pick on him, and they're just very different. And we all develop these mechanisms. The thing is, you need a mechanism. And I think that the way you do it is you're just like, man, I'm just going to study. You guys go out and party. You could say whatever you want. I know what my goals are, and I'm going to do them. I've seen people go to jail. I've seen drugs. I've seen whatever. So just love that level of resiliency. And I think that training people that want to go to med school and become physicians, resiliency training is massive for them, because some of them don't know, right? Like they don't know what it is that they're going to encounter. And as you know, with a lot of different mental health issues now and things like that, some of them are really affected by it. I had numerous classmates that had to actually take a year off during medical school because they ran into mental health issues because they weren't quite resilient to be prepared, or they were going through their stuff. But there's a lot to go through. Maybe that's the military thing. You're like, whatever, that's not a big deal.
It's challenging for everyone. I think it's definitely a different change of pace, and in your college kind of years in college, and yeah, people struggle. It's hard. You have to have a really strong support system, and just make sure kind of that balance between medicine and non-medicine and outlets in medicine. And I kind of stress this and talk about this in my videos. A lot of people don't really talk about the suicide rate in physicians, starting as early as medical school, and sometimes in pre-med years. We just don't talk about that, but it's a significant problem that needs to be addressed.
Thank you. I really appreciate you bringing that up. That was not a question I was going to ask you specifically, but in the setting of medicine, the amount of depression, anxiety, and other things is unacceptably high. And actually, there's studies out there that show that medical students are already as stressed as practicing physicians during medical school. And you know what, in these formative years, I mean, to live all these years and years, with stress. And I've had families actually reach out to me because I've made some posts about mental health, and especially physicians. I've had families of physicians who have committed suicide. Obviously, we keep it private because it's not something they want to reveal, but it's just sort of a thank you. And I've actually had somebody send me their son's journal that he was keeping before he committed suicide. So thank you for bringing that up. It's so important to have awareness that we're stressed, and we come up against a lot of obstacles from everywhere, right? As practicing physicians, it's really hard. But being aware of that and taking care of ourselves, our health, our mental health, just well-being is really important. I was going to ask you about, kind of challenges in residency and things like that. And people kind of get it. But if you had to give students, either pre-med students or medical students, some advice on what things that they really need to be thinking about before going down into a field, like a high-level field like you're doing, like orthopedic spine surgery, like we've done, or just orthopedic surgery in general, going through that process, what do you think is like the most important kind of message we could give to those aspiring people as far as whether or not they want to go into these professions where there's more kind of life and limb things that they need to deal with as opposed to going down different paths, because everybody has stresses. Listen, bus drivers have stresses, and the mailman has stress. Listen, everybody has stresses. We're not like special like that. But when you do what we do on a daily basis, it's a different level. What would be your advice?
I would say find something that you love to do. Like you said, every field has a level of stress to it, from the person that's picking up our trash to the person that's cleaning the cars to the front desk person at the hospital. Everyone experiences a level of stress, and no matter what field that you go into. So I would find something that you enjoy. I mean, I love spine surgery. I love orthopedic surgery, and I can't think of any other field that I would rather be doing. If you find a field or an interest that's that way, I would certainly kind of pursue that. And some people get blindsided by the fact that, oh, as a surgeon, you're not going to have a lifestyle. It's going to be busy. You won't be able to do much. The hours are crazy. Really, you can make it how you want it to make it. I'm in private practice, so I can make my schedule as I can work 3 days a week if I wanted to. I can have off every Friday if I wanted to. So you can really make your schedule, depending on what type of practice that you join and what type of, whether it's academics or employed or private practice, so I wouldn't let that detour your plans or your ideas of becoming a certain specialty. I would also say don't let a rotation change your perception of a field. Just because a resident may be upset about their rotation or that attending was an a-hole, or so if you're interested in orthopedic surgery, you had a bad rotation, maybe it was because of that rotation, not because of the field of orthopedic surgery as a whole. So some people say, hey, I didn't go into this field here because I I hated my rotation. But I would just make sure you keep an open mind when you're choosing a specialty, and just find something that you enjoy doing, and it's going to click, it's going to hit. I remember I was laying in my bed in medical school, and that's when I decided I wanted to finally do orthopedics, because I was between emergency medicine, urology, and I think orthopedic surgery, and it just clicked. I said, this is what I want to do, and ever since then, it's been the best decision ever.
No, and I love it. And what you're saying is absolutely, spot on. Number one, we want people taking care of us. Like, right, if I have a back problem, I want my spine surgeon loving spine surgery like you do. I want to come to you to, to get it done because you love spine. I don't want somebody that went into it because their family has been doing it and they feel forced and every day is horrible, or they just feel like they're not, satisfying. It brings up the point of, I like to always try to inspire people to do what they love. I'm not telling people to go and quit their day job if their kids are not going to be able to eat food, right? And start some entrepreneurial thing. But ultimately, the real source of happiness or contentment is not necessarily how many dollars you have in your bank. It's really not that at all. How many studies have shown that? It's if every single day you have a purpose and you really love doing what you do, you enjoy the process of doing it. And again, it's really inspirational talking to somebody that clearly, like, you exude this stuff. That's why your videos do so well. They're so well done. It just inspire. Listen, I do what you do, but then I watch a guy like you and I'm inspired to do what I do. So it's just, people have to just see, kind of where we're all getting our inspiration from. But it's because seeing a like-minded person that loves doing what they do every day. I think that's the best advice. And people should not go into medicine just because they want to be an MD or they want to do whatever, because it is a source. There's enough misery in our ranks right now that one of the things, and I'll have you speak to it. You already mentioned this before, but if you have anything, there's an article. Now I just can't remember exactly who it was published. I think I got it out of Becker's, but I don't remember the author. But the unfortunate thing is they asked practicing doctors how many of them would recommend, going into the medical profession. And here the number, 40%. 60% would not even recommend doing what we do. Meanwhile, my son, he's gonna go do pre-med in college. So I think it's a wonderful thing to do if you really, want to do it. But it's very sad that you've got that people, right? Ultimately, it affects the patients. If 60% of their doctors don't even want to be doing it, we've got to change something. So what do we need to do to go from 40% of physicians recommending the profession to 80% or 90%? Something's wrong, right? If 60% of airline pilots don't want to fly, I don't want to fly. I don't, right? I don't want to get on the plane. That ain't good. So what's wrong?
I would probably go back to the reasons why people are leaving medicine currently, and what people are complaining about. Number one is insurance. These authorization, the reimbursements are declining. Number two, I would say it's for a lot of people, sometimes the work hours, they're being overworked. Number three, the kind of this whole administrative burden that we all go through as doctors. So, and I think before we address that 40% and try to get it up to 80 or 90%, we have to at least look into those three things.
Yeah, I agree with you. But those three, I mean, just hit it, nail right on the head. I would say the overall with all that, and I talk about this a lot, and that is a lot of physicians that are disgruntled. I think one of the biggest overarching things is they feel like they've lost their autonomy. They're not making their own decisions. You brought up administrators. I know a lot of great administrators and not so, everybody, different, but it's become a big, huge, overwhelming system that's difficult even for us as physicians to navigate. And it's causing a lot of, disgruntled behaviors. And that's why I really commend you for being a private practice guy. We're a private practice, organization. We have 8 of us. You guys are private practice. And like you said, you want to work 3 days, you work 3 days. That is really a source of contentment, right? Because you feel like you're creating your own destiny. You do what you want for your patients because you're not necessarily, listen, we're all constrained. We can't do whatever we want to do, obviously, but having that level of autonomy. Orthopedic spine surgery, it's a lot easier for us to be independent because we just have a little bit more power than some of the other specialties where if they don't really melt into a system, they can't even keep the lights on. How do we support private practices? And I know I'm giving some of these questions are, they're difficult. It's not like I'm not telling you I have answers for them. But I love having these discussions, like how can we support private practices? Do you think maybe we need to go more do you think we need more legislation to protect private practice doctors? Is it an insurance thing? Do we need to change the way reimbursements are doled out or how those decisions are made? And we're going to get into prior authorization here in a little bit, but do you have any fixes potentially for helping people to have more autonomy and be in private practice?
Yeah, that's a great question. I'm not sure the best way to kind of answer that, but just like you said, I think the reimbursement's huge. Each year, we're paying more and more for our expenses. Our leases are going up. Our employees, they want more each year. All of these things are going up, but the physician pay, it's going down. So at some point, there's going to be some type of breaking point eventually where it's going to be hard. And I've seen a figure. I don't recall the exact number of people that are employed now or hospitals that are being bought up by private equity firms. But the numbers are up there, and the number of private practices are going down each year from my just recollection and just being in the medical field and been in practice for the last 4 years. That's just my interpretation of everything. But I think some type of restructuring of our reimbursement system where we can actually survive. I think that's important. And also just getting the people in Congress to actually support those of us who are in private practice. I think that's important as well.
Absolutely. And again, it wasn't like to pressure you on that because honestly, I don't have the answers either. I talk about it a lot and I know our situation, we have a very unique situation where we have a lot of neurosurgeons, so we can kind of lend lease our services out to different hospitals. So we do it our way. We were also in an environment where we've got a group called TCO, Twin City Orthopedics, and I respect them a ton because they've created a way for orthopedic surgeons to really be in private practice and have a lot more power themselves as opposed to kind of going into hospital organizations. Listen, some people love it. Some people like being employed doctors. They really do. I have friends, they're employed doctors. They love it. They get their thing. They don't mind. They're happy. They're happy with their, but a lot of other people, it's a big source of consternation. So yeah, thanks for, that answer. Let's shift gears because I love the YouTube video that you made on the insurance mess. And it is a complete debacle. It's confusing not only for physicians, but also for the patients. And it's crazy. If you even try to look at a handbook of the patient's handbooks on an insurance, if they said, doctor, help me with this, I was like, I can't. I don't know what it says. It doesn't even make sense. It's just words. And then we have AI involved in making, and declining patients for things that they absolutely should have. And I just, I have a radio show that's coming out. I just filmed an entire hour monologue on the insurance industry and how it's difficult for patients. And it's really, really onerous. There's all these different ideas that I have, but I just wanted to pick your brain because you did a beautiful, video on this. So can you tell our listeners, just what are the biggest problems right now with the insurance authorization process, and how is it making it so difficult for both providers and patients to give good care in that doctor-patient relationship that we've worked so hard to establish?
Yeah, I usually kind of explain to patients, you spend all this money on insurance, but then when it comes down to using it, you essentially can't use it because the insurance is trying to essentially deny everything that we try to do. We've all heard about these AI bots at insurance companies, this huge lawsuit that recently came out that their first initial response is to deny, and which I don't think it should be that way. And every surgeon has stories of crazy patients kind of experiences where with this whole insurance authorization process. I know I had one patient who I think I was trying to do an ACDF, and I spoke to I believe it was a pediatrician, and I told her kind of what my plan was, and it was kind of fairly detailed in my notes. And she asked me, she said, "Okay, you're going to take the disc out, but why do you have to put something back in there?" I was like, Lord have mercy. So sometimes a lot of the during the insurance authorization, during the appeal process, when you're trying to fight for these patients, it's usually someone that's not even in your specialty. You're supposed to, you have the opportunity, I believe, to ask for someone in your specialty. And that's kind of what I did for that case and ultimately got it approved. But it certainly wears you down. I don't have the right answer to what the solution is for it. I just think more people need to advocate for this and just speak up about it.
Absolutely. And I have so many horror stories of people that have been, unjustly denied. The problem is, if I'm not the one who's in pain, the patient is in a lot of pain. And the problem with all of these denials is that then they are put off and put off and put off while they're having pain. And obviously we are aware, if you've got a sciatica or you have horrible back pain, it's crippling pain, especially if it's so bad that you're requiring, higher level medications and things like that just to keep you out of the hospital. That is such a disservice to the patient. So what I'm preaching, I think the number one thing is that patients really need to understand what they're signing up for when they sign up for insurance, and have a very deep understanding of the processes that need to go on for them to get approved. I don't know what you feel about it, but a lot of my patients are very upset when I tell them, I'm sorry, your particular brand of insurance requires you to have 6 weeks of physical therapy, minimum 10 sessions or 12 sessions. They're all different. And the problem is a lot of them are so upset, they don't want to do it. And so then they disappear for a while, and then they call back 2 months later when they've got a little bit of weakness on their foot or something, and then they're really upset. Then they have to come back in. So we waste all this time. So I think educating them, right? Like, as opposed to them coming in and having no idea and having complete shock. What do you mean? I have insurance. The doctor's telling me what to do. I don't know. Why can't I have? I don't understand.
Yeah, you're absolutely right. I face that on a daily basis as well. And, a lot of patients, they'll point to their MRI and their x-rays. What do you think physical therapy is going to do for that right there? It's really important to just educate them. Say, hey, I've done this so many times. This is the process. This is what I recommend that we should do. And patient education is critical. That's what I really try to stress to my patients. And all of my surgical patients get an email from me that has information from my website, a video that explains their condition, about what my plan is for them, and also for a way for them to get in touch with me if they have further questions kind of moving forward. But patient education is critical. And yeah, it's something that we need to do a better job as physicians educating the public and our patients.
Yeah, absolutely. I mean, I would say in summary, and I did a video on this. I mean, I try to be careful because obviously we need insurance to help our patients and things like that. So we're just trying to educate and just let people know what is the truth, what is really happening. Like you mentioned, the AI bots, all these other things, right? They're doing AIs, and then the hospitals are buying other AIs, and then the insurance company gets even more powerful AI. It's crazy. People need to know what are going on behind the scenes. But something I posted in a video was the following. I just want to make a statement because it's important for us as physicians to advocate for ourselves. And that was the following. I don't remember, maybe you do, you tell me, I don't remember in med school them teaching that the doctor-patient relationship. I thought it was between myself and the patient. I didn't realize it was between us and then the third party, which is the insurance company. I didn't know it was like a three-way, circus of trying to figure out how we can help these people. Maybe you were taught that at Georgetown. I don't know. I don't remember that.
I definitely don't remember that either. And if it's that way, there should certainly be a way for us to kind of get together like this Zoom here. And if there's someone from the insurance company, a surgeon that works for them, hey, let's look at this patient clinically. Here's the patient here. Here are their MRI images. Let's scroll through them so you can see them. You're not just reading a report. And we can all make an informed decision. If that's I actually never thought about that, but that's actually a great idea.
Oh yeah, let's do it. And I've talked about this a little bit before, but we should have some of us and do a webinar, but also have insurance, on the webinar and do a good educational. Obviously, we want somebody that's very educated from the insurance and maybe an insurance doctor that does this for a living and talk to us about how patients can get more educated. I think it would be a great service. So, okay, we got another project to do.
No, I was saying I get emailed all the time from coders, medical coders, and they'll say, "Hey, Dr. Webb, I watched your video. I really understand now what that doctor is talking about when they're talking about an arthrodesis or doing a laminectomy or some type of fusion or disc replacement." So and they'll just generally say thank you. So not just for insurance companies, but also for billers and our coders who they're behind the scenes. They may not see exactly what's happening in the operating room. They're used to that terminology, but they've just never seen it before.
I love that. And I would just say, what we do sometimes, like at our institution, we actually try to get our employees in with us and spend the day with us in the OR to see what we're doing, because then it's real, right? It's not just numbers on a piece of paper. And unfortunately, the people that are making decision on the insurance side, sometimes, like you said, sometimes it's not even same specialty. Sometimes it might even, so it could be a vet. It's possible. Right. And so they don't really know what we're doing and educating. So that's a good segue into like what is really near and dear, to me. And that is the huge importance of us as physicians, especially the ones of us that we're okay talking. We enjoy, being out on the stage, and not the stage, so to speak, but actually like doing all those videos like you're doing, putting yourself out there, all in the name of educating patients. That's what I want to do. That's what I'm really dedicated for. You're doing an amazing job. Actually, I've got so many great ideas from what you're doing. I'm like, I got to do that too. That guy is like on it. I know you're into cinematography and all that stuff, which it gives you a leg up. I have a younger son though that helps me with a lot of this, because otherwise I didn't even know what camera to buy and all this other stuff. But on the segue, I know that you are doing some teaching now coming up for other physicians that want to get out there. So number one, why should physicians be out there doing this? Why should they put themselves out there? I know I mentioned briefly, I had Dr. Betsy Grunch on, and that was literally the main focus of our podcast, was discussing how important it is. But why should they be out there? They're like, I have a good life. I do my surgery. I'm done at 4. Like, I don't want to post. I got to make a video. Like, why is it so important for them to be out there doing it?
I always tell people you are already out there. I mean, if you Google your name, there's information out there about you. There's other websites that are putting out information about you, and whether it's true or not, that's ultimately kind of up to you, kind of reviewing that and making sure it's actually accurate. But social media just doesn't have to be video. I mean, it's podcasts, what we're doing, social media posts, blog sites. I mean, there are a lot of different formats of social media, but I think it's really important for physicians to educate and to teach not only the people that are coming behind you, the other residents, medical students, junior attendings, but also patients. When a patient leaves your office, they really don't understand most of the time kind of what that encounter entailed. When I tell them they have an ispic spondylolisthesis or some type of lumbar stenosis, they really don't understand that. I mean, we're together for approximately 15, 20, 30 minutes at a time, and I tell them all of this information. The first thing they're going to usually do is go home and Google. You don't want them going home and Googling someone else's and get landed on someone else's website. So, and that's my future project, is to build something where as soon as a patient leaves my office, they're getting some information about the condition that I diagnosed him with, what our plan is, what the next steps are, what happens if this fails. So that's my kind of next project. But my current project is called Social Media for Doctors. And this is an online course where I'm teaching doctors how to use social media. You know, that's a passion of mine, is just to put out information. And I just wanted to put it into a digestible format where physicians that are really busy, they can just take this information and just run with it. And because everyone is not built to be on social media, and some people are not really comfortable being on social media, and that's okay. You don't have to. I think you just have to find out what works for you. If you're not comfortable doing something, a certain format, what about another blog or just getting on a podcast like this? So there are a lot of different formats that you can do just to put yourself out there, but I think it's really important, especially in this day and age.
No, I mean, I think that that's great advice. So one of the things that, I've talked about with physicians that are out on social media like yourself, which is a barrier, because I know many physicians who either really want to be on social media. Okay, now I know where to direct them. I'll direct them to your course. They either want to be on social media, and honestly, they don't know where to start, or they're going and seeking help from these like legacy social media folks who started from the beginning, but they haven't really morphed into what you really need to do now, at least to get some eyeballs and things like that. So they just don't, they don't really know how to do it. I will tell you, I spoke to a neurosurgeon, privately. We did a Zoom call because he just wanted to talk to me, just pick my brain. But it's very interesting because he had started doing a lot of stuff on social media, and he started a podcast. And it wasn't very long before he said he kind of just gave it up, because he just felt like he wasn't breaking through. He said, you know what, I would do all this preparation, do all this research on my guests, do all this work to do the best job I can, be out on social media, and no engagement. So how do you get over some of those things, like where people just feel like, it's not even worth it because no one is watching? Like that is really one of the barriers to these guys, can either starting or continuing. So what would your advice be to them on like just keeping going?
Well, you just got to keep going. I started using my cell phone when I first started making videos. I was sat in my car as a resident, either on the way home or to work, and just started talking about various topics. And my videos didn't get really many views. I mean, maybe 100 views here, 200 there, but I was really consistent with it. And you have to be consistent. And I think as a resident, which was probably pretty crazy, I was putting out videos Monday, Wednesday, and Friday, so 3 times a week. And my viewers knew when I was going to put out a video. It's at 5 p.m. Monday, Wednesday, and Friday. And I was just really consistent with it. And just over the years, just doing it over and over and over again, not really looking at how much engagement, because if you encourage or if you inspire one student to go into the field, or if you have someone that just watches your video, a patient, and that changes their life, I mean, that's all worth it right there. It really depends on what your goals are when you get on social media. If your goal is just to educate, it really doesn't matter how much engagement you get. Someone's going to see your video. If your goal is to go viral, then that's a different story. Sometimes that's hard to do. If your goal is to promote your practice, that's a whole different kind of avenue. So you really have to the first thing you have to do is like, why am I on social media, and what my purpose is? And then that may be able to answer those questions when no one's watching your videos. And even though I've been on social media for a while, there's some videos that don't do well. There are some posts that don't do well. I just I'm persistent about it. I put it out and think about the next project and keep going. I don't really look at the numbers per se, but I just love putting it out. And that's kind of what I've done over the years.
Yeah, and I think that's great. I think you said it really well. I mean, a clip of you just saying that will really, that's really much what people need, because they need to understand that it is just the consistency. And I love the way you framed it. You're one of the first people that I've heard frame it that way. Somebody's going to watch it. And it goes back to what we said before. That might, if that inspires one person and changes their life, you've done their job. So I think you're absolutely right, not focusing. When I started doing this more intensely last year too, I struggled with that too. I would put things out and I would think that, I'm like, I put so much effort into this. I've thought about this, I've spent 2 days, getting it just right. Then you post it, and you get X amount of views and you're just wondering, I just spent a lot of time doing that. But yet you're absolutely right. If somebody sees it and is inspired by it, or it just changes them, or they just change a little bit, if they pick up one little habit or they get one little thing from you, it's absolutely all worth it. Love it. I'd say the last thing, as far as kind of the doctors being on social media, and we talked about this a little bit, before we started the show, dealing with negativity on social media. A lot of doctors struggle with that, and I've talked to them, too, either on podcast or whatever, but they really struggle with that, because the vast majority of people that are outdoor doing what we do are absolutely doing it because they're trying to help people. And then you get negative feedback when you are really like 100% of your being is trying to help. And they're just saying, oh yeah, Dr. Webb, yeah, this is just, what is he talking about? He's trying to promote some other thing for whatever reason. How do people, deal? We talked about resilience, right? It's hard on social media. Look at what our kids are going through, right? Having to deal with comments on social media. We struggle like that too, as adults, when we're getting daggers thrown at us, especially when you're an expert and you're really, all you want to do is help. You're not like trying to promote some product that you're selling. You're just talking about an ACDF and how that can help a patient. And then you're getting some, random, hate mail, whatever.
You're not going to please everybody. It's impossible. And I've learned that really quickly, that, you can be 100%, you can put out an inspirational video about just never giving up and keep going no matter what circumstance, and everything positive, inspirational about a video. You can get 5 dislikes or 5 people that are going to comment and say, hey, this video was trash and blah blah blah. Do those comments get to me? Absolutely. Do I want to respond back and say some off the wall stuff like, hey, you don't really know me, catch me outside type of thing? Absolutely. But you have to really just keep it, professional. And I try to do that 99.9% of the time. You're going to get some of that. That's one of the downsides of social media. There are some downsides of social media. That's one of them. You really have to have sometimes thick skin. And even if you were like at a conference, or if you said something that somebody didn't like, I mean, you're going to get the same thing. If you write some type of in a scientific journal and somebody disagrees with you, like we may have disagreements in terms of the way we approach certain spinal pathology. I mean, people are going to disagree. People are going to not like your content all the time. I mean, that's okay. I mean, you can't please everybody.
No, I love it. That's again, a great way to reframe it. I think this has turned into a master class on resilience and how you get to, these things. And I love, what you said, because I recently had, a situation, again, 99.9% of the time, we talked about this briefly earlier, 99.9% of the time, I really don't respond because you can't make everybody happy. But just very recently, I had a situation where, I like to really look for non-opioid alternatives to really try to help with the opioid crisis that is such a big problem. And we talk about it. And one of my concerns with the opioid crisis in general is that there's a lot of talking, but there's not a lot of really good legislation or a lot of concrete things. And I do agree, just cutting people off from their medications without options is a very, very bad option for them. But anyway, I've been doing a lot of posts on things that can help people with their pain that are outside of what they would traditionally think about, all based on scientifically vetted, things that are, by the way, FDA approved. I talk a lot about light and laser therapy, things like that. Not all orthopedic surgeons. That movement is growing, but still small. And the pushback I got from it, from some, organizations that are, promote opioids and are very, we're very upset by it. And I had to do I did a professional response. It was a very long response to it. And I hate that I had to do it, but it's very, very important because it's a critical issue. And we can't allow things to circulate around. So I get it. If somebody's just criticizing, I don't like your video, that was dumb, whatever, that's very different than taking your words and saying things like, as doctors that want to decrease the use of narcotics, that we are the ones that are driving people to go and get fentanyl on the streets. You say things like that, it's very dangerous. It's not dangerous for me, but it's dangerous for society, because that is not the picture. We are all trying, listen, you're an orthopedic spine surgeon. I know in Texas, there is a big push, right? Just like there is in Minnesota, to decrease the use of narcotic medication. So we have to look at other things. Sorry, I went off on a tangent. What are your thoughts on it? I mean, I'm sure you would agree that we need to do something about this, but we also need to be very careful with misinformation. I'm sure. So here, the last thing I'll say, because I'm giving you like 10 things to respond to. My concern is that when I or you, as board certified physicians, say something, we have to be extraordinarily careful about making sure that we have backing, right? If we come out and say some crazy thing like, oh, if you have this pill, it's going to cure your Alzheimer's disease, like some pill that you get at CVS because I'm sponsoring it. That's a no-go for us as physicians. Why? Because our licenses, our reputations are on the line. But anybody, especially since the pandemic, can just get on the internet and say whatever they want with no scientific backing whatsoever. And sometimes that spreads a lot more than your word or my word. And it is a problem. And so at least we need to take a stand and then put out information that is true and at least defend ourselves. What's your take on the opioid thing and just having to defend ourselves in certain situations?
Oh, it's a problem, and I applaud you for speaking up about these issues and just trying to think outside the box. Because honestly, I haven't seen too many people address that topic and just try to put out information for patients that's actually helpful for them. I mean, narcotics are dangerous, and going into this whole opioid crisis and shortage and all these issues that narcotics can cause, I applaud you for just speaking up about it. That goes back to one of your initial questions, like why should people be online? And this is a perfect example of that. There are a lot of people out there that call themselves doctors, but not really doctors, that are online, and they're feeding this misinformation to the masses. And this person that you spoke about has a pretty large following, and a lot of people are listening to this person, which is not the way it should be. So, and that's more reason why physicians such as ourselves should be online, should have a presence to speak about these issues and just dismantle all this misinformation that's out there and let the public know, hey, this is information that is backed by science, backed by literature and research, and this is the real truth behind these issues at hand. So
yeah, and actually, and being able to take information based on not just our training, but also our experience, seeing patients from all walks of life, having all different types of conditions. One of the things, again, I do not have a problem. I wanted to make it, I always make it clear to my audience, everybody should be able to have an opinion. Okay, that's not the issue. Again, the issue is that if you don't have the experience in the understanding of the totality of the situation, as physicians, we are trained in the entire human body, right? We know pharmacology, physiology, all these things. And then eventually we learn so much more through our practice. So we understand which patients are at risk for this, which patients, now we don't know everything, right? We're not perfect, but we know a lot more than people that just take one specific topic and just make it just about the one thing, because they don't understand how this one thing affects the totality of the human body. And it becomes, frankly, it's dangerous sometimes. And again, they don't have to answer to a medical board, right? If I'm putting out misinformation or you're putting out misinformation, guess what? We're going to get a letter. That's how it works. Who's giving them a letter? No one. So the only thing we can do is try to build communities of education for our patients and for the general, community, and even other physicians that are just interested. I'm sure you have a huge physician following. People are following you just to learn, what's new in spine surgery, what's the latest in minimally invasive, all that, all the technical stuff, and then all your inspirational stuff that you do. But we are able to cut through the noise because we get it. We could see kind of what's real and what's not. Again, we're not perfect, but again, a lot of these people that have opinions, they're not voicing it as an opinion. They're voicing it almost as medical advice, and then it gets really dangerous. It's borderline. We have to take a stand, against things like that. So, anything else you want to say on that front?
Just find your why. I mean, if you want to get on social media and put out content or write a blog post, just find your why. And for me, that's an outlet to medicine. That's what I love to do, and that's what I do kind of in my free time to get away from everything else, is just to go out and film and shoot and fly my drone and things like that.
Oh, so do you ever make videos with your drone?
Absolutely. Yeah.
I have not seen that. You got to send me some. Oh, it's awesome.
Yeah, this is a Mavic 3 Pro here. This is what I commonly fly, and my videographer also has one that he flies as well for me.
Oh, that's awesome. All right. See, I'm getting all these ideas. That's why I like talking to guys like you. This is what we're doing. We're sharing, we're just sharing this information. But yeah, I thought I had already gotten tons of ideas from you. But now I got to talk to my 15-year-old. I'm like, let's get a drone. Let's get it going. We got to make some, some different stuff. The last thing I kind of want to talk to you about, my show generally is more geared for people getting to know you and some of your thoughts on some of these other things, different, instead of just sitting here. Because we could talk, listen, we could have a 10-hour show about how do we like doing ACDFs, what's the latest in minimally invasive, where do you put your ports in, the cameras. I know you're doing really cool stuff on the minimally invasive front. I do some minimally invasive stuff. Love to pick your brain separate on that, because I know you've started doing some newer techniques and things like that. And that's great because we need that, and we need innovation. But here I really want to get people to know our guests as a person, what drives you, because in many ways, again, that's the inspiration that many people need to say, hey, Dr. Webb is doing it this way. Man, he overcame this. He's doing this. Man, he's doing all these things. He's flying a drone. This guy, like, he does everything. Like, who is this guy? So we want to get that. So I can't not ask you about your time in the military. You have some really cool stories about, the military and things you went through. How did your military experience kind of shape, who you are? And you've operated in so many different countries and things like that. So you have such a diverse background. That's all in the introduction, where we talk about, all the things that you've done. But how has that influenced you now? Do you feel like seeing all these different cultures and being in the military, does it shape the way that you approach your day-to-day as a physician?
Oh, absolutely. Yeah. It's the reason why I am the way I am. I mean, I'm very disciplined. My schedule is to a T, and it has to be that way just because of my time in the military. But our 3 core values in the military was service before self, and integrity first, and excellence in all we do. And I extrapolated those 3 core values and just molded my life around that, and my practice as well. So yeah, the military really set me up for success, and I don't have anything bad to say about the military. And it made me who the person I am today.
I think the military, I mean, I didn't go that route, but I can tell you that, and this, I mean, I'm just saying, first of all, thank you for your service, but I will say that almost every person that I meet in a professional setting that has had some military experience really brings that into the way they do things. It disciplines them. It gives them a different perspective, and it makes things honestly easier to deal with some of the things that you need to deal with as an orthopedic spine surgeon, and then trying to do all your other stuff, because you're used to it. You've seen some things. You've been around bombings, and you've been to all these different countries, and you've done these things. And so when you're having a bad day as an orthopedic spine surgeon, it's all perspective.
Life is great when you're here in the States. I mean, it's nothing like getting shot at while you're trying to take care of a wounded person. So being in the stateside, taking care of patients, I mean, that's a great life. We were shot at every day for my entire time in Iraq. I mean, that was a dangerous time getting shot at. You can't imagine getting shot at while you're trying to take care of a person that's wounded.
Yeah, I read somewhere that you were in Iraq, that you were kind of around over 100 mortar attacks, like during your time there.
Yeah, we were at a location. It was actually the most attacked base in Iraq at that time. There was one instance where I had a RPG, a rocket propelled grenade, actually go over my head, and I heard it go over my head and it hit the ground. But luckily, it was a dud, which means it didn't explode. Otherwise, I wouldn't be here talking. So they had to call the explosive ordnance team to come in and detonate it. But yeah, we had a lot of close calls that way, kind of during my time there.
When you're going through that, you don't have those, RPGs going over your head right now. So
Oh, nothing.
it's all relative. So even though I didn't do it, I'm going to live vicariously through you, because I hear stories from, that obviously friends that have served. And then a lot of my patients love talking to them about their service, always thank them for their service, and then get into their stories. It's just fascinating. So it makes what we do, listen, it's an honor and a privilege, right, to do what we do. And so sitting around complaining about us having bad days, obviously there's going to be things that go wrong, and patients that struggle and things like that. But again, it's all relative. And if we can be our best selves, be disciplined, do what we need to do, focus on excellence, then we can be there for our patients to take care of them and do those things. So thanks for sharing, that. So in closing, I just want to just tie up a couple of things with what you're working on. So the Webb Family Foundation that you're doing, is there anything that you'd like to tell our listeners about how can they get involved in that? What are you guys doing? What's kind of next for the Family Foundation?
Yeah, so I actually started the nonprofit, the Webb Family Foundation, which is a 501(c) back during the pandemic. And really, it was after a study that came out that showed that there were more Black men in medical school in 1978 than there were in 2014. And I was just really shocked by that number. And also just knowing that less than 1.9% of orthopedic surgeons are African American. So the goal of my nonprofit is really to increase diversity in the medical field, specifically orthopedic and spine surgery, but also just expose young kids, students to various fields in medicine. And, hopefully this upcoming school year, we'll be able to give out some scholarships. I have a 2-week summer program that I do every year, where students come in and spend some time with me in the operating room and surgery. We do some research together. It's one of those things I just love to do, is just mentor and give back and help that next person get to where I'm at. So that's what the Webb Family Foundation is about.
No, and that's absolutely wonderful. And then as far as, what about physicians that are very interested in social media? How do they find your site where you can give them some help? We'll just have that on the screen so they can find your location.
Yeah, all of my social media sites are pretty much Antonio Webb MD. Just type that in YouTube, Instagram, TikTok, Twitter. But the social media for doctors, socialmediafordoctors.com, and hopefully we'll be launching that here in the next few weeks. It's supposed to be on Social Media Day, the World Social Media Day, which is June 30th, but we had a couple of hiccups. We're trying to get CME credit for it as well, so we're in the process of doing that. But hopefully the next couple of weeks to months, we'll be able to launch this project.
That's excellent. And I obviously now I have a great resource to learn, because I have a lot of people that I know. When you have an actual course, it's really nice, instead of just saying, well, just look at what I'm doing, because look what I'm doing, or look what whoever else is doing. That's hard. They're so, it looks insurmountable. And you've been doing this a lot longer than I have, as far as, presence on social media, but having a course where they know how to start. Because I didn't go to a course. I just kind of started looking at guys like you and what other people were doing, and just started trying to follow and saying, hey, my message is different. We're all very different. Obviously, we all have different messages and stories we want to tell, but it's a lot easier if you have an actual resource that you can go to. Because again, I want to jump up and down imploring people that at least have an interest in it to do it, because we need more experts like yourself out here, really, training and teaching and helping us to navigate this complex world that is getting more complex by the hour.
Yeah, and social media is so powerful. I actually had a physician called my office on Friday. He called and said, "Hey, I just need to talk to Dr. Webb. Here's my cell phone number." So I called him back, and the first thing he said is, "Hey, my name is Dr. Such and Such. I don't want anything from you. I don't want to sell you anything." You know, he lives in Virginia. He just said, "Dr. Webb, I watched your video and just wanted to tell you how proud I am of you." So, and I get messages like that from people from all over the world, from Iraq, from Afghanistan to Germany to Italy, Turkey, and I have probably about 25% of my practice is actually patients that travel in to see me, and it's a very powerful thing. And as we mentioned, there are a lot of benefits, but there are some downsides to social media, and just find your space, find your why, and that'll help you in terms of guide you in terms of which platform and how much you should be putting out, and also what you should be talking about. But just really just talk about your specialty. People want to, you're the expert. Talk about, ENT or emergency medicine or pulmonology. I have a good friend who's a world-renowned pulmonologist from social media. Every time I see him, he's in France, Italy, Germany, giving talks all over the world. It just blows my mind. It's from social media.
So that all started from social media, and now he's traveling the
Yes.
world. That's
He,
amazing.
he's been to probably 10 countries this year alone, just because people want to, he just goes and talks about his specialty, pulmonology. They invite him to all these conferences. I'm kind of envious of him, but yeah, he's all over the world, like world renowned just from social media.
Well, that's amazing. I'll have to connect with you on him. I want to see what he's doing. You'll be there in no time, and you're already getting there. It's just for you, it's just a matter of time. Last thing, I just want to go back to one thing you said before, because I think it's important before we close up. I did not know that statistic on Blacks in medical school going down.
Oh,
Like
yeah.
from the 70s I did not know that. I really did not know that statistic. My question is why?
There are a lot of different reasons. I think this study came out in 2015, and as I mentioned, the study found that there were more Black male medical students in medical school in 1978 than there were in 2014. But the reasons are really multifactorial. It's a lack of mentorship. There's a lack of access to various mentorship programs, and just exposing students to various fields in the medical field. A lot of social economic factors that come into play as well. So there's been a lot of change in terms of various institutions trying to make some changes so that we can kind of reverse that trend.
That's a shocking number. I didn't know that. I'm upset that I didn't know that, because that's a shocking trend. I mean, I try to do my part, obviously, in helping with diversity issues and talking to young people and mentoring and things like that. But that's a staggering figure that I was not aware of. Thank you for bringing that up, and thanks for everything that you're doing to bring this out. And like I said, if you need my assistance on anything whatsoever, I'm at your service, definitely to help, because it's just not, and again, I think everyone should have an equal opportunity to be successful in the thing that they really are passionate about, and socioeconomic issues are just other barriers or whatever. I think that sitting around, complaining about it is not the right way to go. And folks like yourself are out here doing something about it, making an impact, making a difference. And impact makers are just way too rare. We just need more impact makers. So thanks for what you do. Thanks for coming on the program today. It's been incredible. Like I said, it's a tour de force of resilience. I think anyone that listens to this feels more resilient just listening to everything you said. Great information on social media and other really challenging things that we've got going on in our society today. So I really thank you for coming on the program, and I hope many people watch this to the very end. I think they're going to have a tremendous amount of information that's imparted from everything you've said today. And I honestly think this is absolutely one of the best episodes that we filmed here on Wellness at the Speed of Light. And it's exactly what I thought it was going to be when after watching all your stuff, I'm like, I got to get this guy on. And I'm glad to, have met you in person.
Yeah, thank you for having me. It's been a pleasure. And yeah, look forward to kind of more content that you're putting out. I appreciate all of the, words of advice and feedback and wisdom as well from you.
That's great to hear. Yeah, we'll just, we'll keep fighting the fight. We'll put it that way. So everyone, thanks for being on another episode of Wellness at the Speed of Light. I hope you really enjoyed this one, and we'll see you on the next episode.